So this grant is a phenomenal opportunity for pediatric lupus research and really represents an incredible commitment to this patient population. And we really hope that it will improve our understanding of how we can better care for patients with pediatric lupus. I think patients and families are really at the heart of the work that we do, and they're the reason we do this research. And we're hoping that by having patients and families participate in this research through the CARRA Registry, that we'll really be able to improve our understanding of best treatments and outcomes for these patients. This grant was many years in the making, with a lot of incredible advocacy on the part of many organizations, including the Lupus Foundation of America and CARRA, to recognize the importance of this research and improving the care for patients with pediatric lupus. So it was the work of a lot of people who made this possible, and we're really fortunate to have such great partners in this research. The work that we do at the University of Utah really focuses on the long-term outcomes of patients with pediatric lupus and their outcomes into adulthood. So that's a focus that we hope to bring to this award as well. The upcoming grant, there's kind of several projects, and so as those projects are completed, we'll certainly make the results available to the pediatric rheumatology community, including patients and families. And we will definitely engage patients and families in the best way to get that information out to the community and through our partner organizations.
I think the CDC award that we've obtained is really represents a huge opportunity to advance the field of lupus research forward. We can continue to build the registry and look at really important questions that are just difficult to look at without this kind of registry work. And I think the award really reflects the contributions of our entire CARRA community. We have a lot of different sites and clinicians and investigators who have contributed to the registry work, as well as patients and families. And so just this opportunity is not just for us as the primary investigators, but for the whole lupus research community to take part in advancing the field forward. You can't say enough how important funding specifically aimed at looking at lupus in children is, because there's different points of interest and different outcomes, such as their educational outcomes and the fact that the children are at a very vulnerable point in their lives, that focusing on adults doesn't really do justice to understanding the needs and the outcomes of children with lupus, so that they can really build a successful future. And so that's really what I would want the children and families to understand, is that, it's really great to have this funding that's really directed at understanding lupus in children. At the Hospital for Sick Children in Toronto, we do a fair bit of lupus research. My own research program really focuses on neuropsychiatric lupus, or how lupus affects the brain in children. And we have other investigators, such as Dr. Linda Haraki, who is looking at genetic contributions of lupus, and also Dr. Deborah Levy, who is looking at long-term outcomes of children with lupus. And, through this work with the registry and this new CDC award, it really allows expansion of these areas to really understand, what is the impact of lupus on brain function and development in children as they grow up, and also builds a foundation for doing future genetic studies on a large sample through the CARRA Registry, who the patients would already have information, clinical information, that can then be utilized to understand, the genetic contributions. And then furthermore, with this current award, one of the focuses is to look at long-term outcomes after transition to adulthood. So again, furthering some of the work that's going on in my institution as a single institution, but really on a much larger scale. The voices and the perspectives of the patients and the families are so critical to advocating for funding for lupus, and also for really informing what the research, should be about, and how the research is going to be helpful for patients and families and the lupus community as a whole. So my message would be really stay involved, have your voice heard. And we really want to advance the field of lupus research, but not without the patients and families. It really needs to be a joint effort. So we appreciate all of the effort that has gone into this.
It was an amazing recognition of how important pediatric lupus is to the to the CDC, and also just to say that it was really the CARRA Registry and all of the work that all of the CARRA collaborators have put in to the registry that really enabled this award. And so I think we were all just thrilled with this opportunity to be able to move the research forward that hopefully will really help our patients and families. For us to be able to say to families, to patients and families who deal with lupus every day, that what we're going to be looking at here is entirely specific to pediatric lupus and to what it means to be either a child or an adolescent, with pediatric lupus, I think it's meaningful for us, and we really would hope that this would bring hope to families who have to deal with this every day, think about their child or adolescent both now and what it means for them, down the road in their future. So we do hope that this will really provide families with a sense that the field is going to move forward specifically for them, and that we just won't have to rely on adult data for everything. Children and adolescents who have lupus tend to be sicker, and so they have more organ involvement. They're more likely to have kidney involvement and brain involvement, and so that's a huge impact for a child or adolescent. I think part of what we take care of in pediatric rheumatology is chronic illness, and you have to understand the impact of really any chronic illness on a child and family, about what it means to cope with that every day. And then with lupus specifically, because it can have a lot of organ involvement and the children are quite ill, it's very intensive for the families in regards to medications, hospitalizations, number of doctor's appointments, and they're managing all that in addition to just, being a child or an adolescent and developing their sense of self and going to school and their activities and everything else that they hope to do. So I think that the families who deal with this every day, really deserve our best efforts in this research to really try and improve the research so that we can do a better job taking care of them. Here at Boston Children's, our lupus research centers on a few different focuses. We have clinical researchers here who are currently looking at our lupus population in regards to a number of factors, including disparities in care and in outcomes. And we also work with a number of people in our group who do translational and then basic science research in lupus. You're working so hard at convincing the CDC and hopefully other funding agencies down the road that lupus is a really important disease in children and adolescents, and that this kind of funding and this kind of money is what's really going to move the field forward for our patients and our families. And so their efforts are hugely important and so appreciated by us.